Welcome to this OET nursing lesson. This lesson is designed to help nursing candidates understand how to communicate at a grade B level in the OET speaking test. Let's get started. The scenario. The patient is an elderly person who had hip replacement surgery 3 days ago. The doctor wants to discharge the patient soon, but the patient feels anxious, unsafe, and worried about managing at home. Your role as the nurse is to reassure the patient, explain the discharge plan, and give clear safety advice. Dialogue, Grade B example.
Hello, Mr. Smith. I understand the doctor has mentioned you may be going home tomorrow. How are you feeling about that?
Honestly, I'm nervous. I don't feel ready. I'm scared I'll fall at home even in the shower.
I can see why you're feeling worried. It's very common to feel this way after hip surgery. The good news is, you won't be managing alone. The physiotherapist will give you exercises and training before you leave, and your family can support you as you regain confidence.
That makes me feel a little better. But what about the pain? When will I get my medication?
That's a good question. Before you go, the pharmacist will give you your pain relief medication, and I'll explain how and when to take it. If at any point your pain feels too strong, you can always contact the hospital for advice.
I see. I'm also worried about my wound. How will I know if it's healing properly?
That's very sensible of you to ask. If you notice any swelling, redness, bleeding, or a high temperature, you should call the hospital immediately. Otherwise, the district nurse will check your wound and remove the stitches when it's time.
All right, I guess with all that support, I'll be able to manage at home.
Exactly. You've made excellent progress already and we'll make sure you feel safe before you leave.
That is the end of the dialogue. Here are examples of basic versus grade B language. Showing empathy. Basic. Don't worry. You'll be fine. Grade B. I understand why you feel nervous. Many patients feel the same after surgery, but you'll have support at home and we'll make sure you feel safe before you leave. Explaining pain relief. Basic, you'll get medicine for pain. Grade B, the pharmacist will give you pain relief medication before discharge, and I'll explain exactly how and when to take it. Explaining wound care. Basic, call if you have a problem with the wound. Grade B, if you notice swelling, redness, bleeding, or high temperature, please contact the hospital straight away. Otherwise, the district nurse will check your wound regularly. Encouraging confidence. Basic, you can go home tomorrow. Grade B, you've made very good progress, and with the physiotherapist's exercises and your family's support, you'll be safe to continue recovery at home. This is how you can show Grade B communication in OET nursing, using empathy, reassurance, and clear explanations while supporting patient safety and independence. The role-play card and a free PDF with the Grade B improvements are linked in the description. If you found this useful, don't forget to like and subscribe and check out our other OET nursing role-play examples.